Good morning, good afternoon, good evening, depending on when you're watching this webinar. Thank you for joining us. I'm Tony. I'm the Vice President of Sales at Daily. We're a video API that enables companies to build live video into their applications or websites. Joining me today is Svein. He is also a Daily Nista. Svein is a PhD in digital communications. He spent 5 years building a telehealth company called Confrere during a global pandemic that was acquired by Daily. And now he joins us as our subject matter expert on healthcare. Thanks for being here, Svein.
Thanks. So great to be here.
We are excited to talk about this topic today, navigating the future of digital health. Before we do that, today we're recording this webinar in Butter. Butter is an integrated collaboration app powered by Daily that lets you run super engaging workshops, trainings, and meetings. Not to mention they have incredible hold music when you're waiting to get into a meeting. To learn more, you can check it out. At butter.us. All right, so to get started, Svein, before we dive into some of the mega trends in healthcare and some of your predictions about upcoming technologies, their impact, let's start by talking about the key challenges facing healthcare. I'm sure our listeners are very acquainted with these already, but let's recap what's happening.
Yeah, let's do it. There's a lot of challenges in healthcare, that's for sure. The first one that's probably most of the viewers are familiar with already is the fact that the population is aging. So there's an increased number of elderly people all over the world, and this means a lot more pressure on the healthcare as most illnesses are in the older population, and at the same time less people working in the healthcare industry. So it means basically more demand and less supply. We have lots of things to do and we don't have enough hands to do them. This has been a development that has been ongoing for some time, but it permeates all of healthcare. Second, I want to mention that there's a very high degree of complexity in healthcare. Lots of different things that needs to take place. It's not easy to digitalize healthcare in the same way as other industries can be digitalized, because the needs are so different from hospitals to general practitioners to care centers.
Not to mention the cost of doing it wrong with automation is a very high cost.
Yeah, exactly. So it's if you want to automate things in healthcare, you really need to do it in a very thoughtful manner and do different things for different areas within healthcare. Another challenge is that there's a lot of manual work involved. Of course, any kind of care involves lots of manual work, but there's also currently lots of manual work happening in the administration of care that probably could be automated, but again, since the complexity is so high, it's one of the last things that hasn't been automated yet. The cost is significant, and even more problematic, it's still increasing. That's of course due to the aging population and the high complexity, but also the fact that we just had a pandemic has increased the cost even more. Now that everyone's coming back to the normal situation from the pandemic, and we're spending a lot on re-evaluating the previous diseases. A significant challenge is that healthcare isn't viewed as customer friendly or patient friendly. It's viewed as a antiquated system in a way. Like it doesn't behave in the same way as you're used to from other parts of society, where it's usually a high degree of customer service. And the final one I'd like to mention is that the distribution of access to care is uneven. One problem, of course, is that it's unevenly distributed with respect to the financial means of different people, but also it's very uneven in terms of location. So what kind of care you can get access to depends a lot on where you live. Like, do you live close to someone who is expert in a specific disease, for example? That can matter a lot if you're unlucky and get that disease. And that goes not only, of course, in different countries, but also within a country. If you live in a rural area, it's unlikely that you live close to someone who is an expert in specific diseases. So that's a significant challenge as well that we see in healthcare.
In your time building a telehealth company, you've seen these challenges continue to evolve, but also the evolution of some interesting megatrends that are still evolving now. The first one is the proliferation of digital self-service solutions. What does that mean, and how much is that already happening today? I can't imagine a world in which I'm not talking to a doctor, but talking to a robot. What does that mean?
Yeah, so there's a lot of different things that could be automated. So what I'm trying to do here is to look at what makes the most sense for healthcare. And I think the one thing that really stands out that really should happen, and it's frankly kind of surprising it hasn't happened already, is that there's a lot of things going on in healthcare consultations that really could happen as a self-service solution. So as an example, if you need a prescription for contraception, for example, most of the time that happens after a manual, like after a normal consultation with the doctor, and then you get a prescription for contraception. Really, that doesn't need to be, there's no real need to have a consultation for that. Like, you could do that as an automated service. There are some questions that needs to be answered, and that can be answered in a self-service solution, and then the prescription can be sent to the patient without the need to have a consultation with a doctor. And this goes for many different conditions where you get either prescriptions or some other sort of action based on information that you give. So I think we will see, and we're kind of already seeing, a proliferation of specific apps and services and self-service solutions for specific conditions. And this is commonly called digital therapeutics. So basically you get therapy for your specific condition using a specific digital self-service solution. And I think there's many conditions that's really well suited for this. Any actually chronic condition. With chronic conditions, the patient gradually becomes really like expert in their own disease, and they should really be able to get more help than they get today using automated self-service solutions.
That makes a lot of sense. But despite some of this innovation that's coming, you still seem to insist that there will be a need in most cases for consultation with a doctor, that's not going to be replaced. So how do you think the actual consultation is going to evolve, given this, self-service model that may be coming?
Yeah, I do think so. I do think that the doctor consultation is still needed. I don't think everything can be automated. I think especially patients really want to talk to a doctor. Like, if you have a health issue and you don't know what the health issue is, or you don't know what's the appropriate action to take, you're not going to be satisfied by just getting advice from a computer program. That will work in cases where the patient knows exactly what thing, then the self-service solutions will be great. but it's when it's more like there's an assessment of the situation, of the symptoms, etc., then patients are going to insist on talking to a doctor. So the doctor consultation, I don't think that's going away anytime soon. I think it's going to stay. What we can do, we can make it more efficient. We can make it more accurate. We can make it better in many ways than it is today. So I think we're going to move towards the what I term the Doctor 2.0, which is basically an evolvement of the doctor consultation, giving the doctor tools and techniques supported by technology that can improve. And then, of course, there's also surrounding things like automating the booking process, and there's a lot of the surrounding stuff that can be automated to make the doctor easier to access and make the whole system more efficient, so that more time can be used in these consultations.
So what I'm hearing you say is there will be more options for low-level conditions or simple things to self-service. Doctors will continue to be an important part of the puzzle, but that there may be new technology evolving that will help to automate parts of what they do to make it more effective, more efficient.
I definitely think so. We will delve into the various technologies that I think will come up there later. But I do think that there's a tremendous opportunity to make healthcare more accurate and more efficient by improving on the doctor consultation itself.
Interesting. Okay. Well, the third trend you talked about is happening everywhere across virtually every industry, specialization. How is this manifesting in healthcare?
Yeah, there's a lot. I think we can say that trend has been going on for quite some time already, and you know, in the 70s, everyone went to their general practitioner for everything. It's not the case anymore. Now we go to specific doctors for specific diseases, and there's actually less general practitioners now than there were earlier. So that's a development. I think technology can and will accelerate that development. Of course, because there's a lot of technologies that's introduced for the different specialities, so they get technology tools that they can use in their work, which makes their work more specialized by nature because the technology tools are specialized. But also, if technology makes the consultation location independent, if you do a video call and have a consultation or a video call, or if you have a self-service solution, then the patient can be somewhere else than the doctor. Mm-hmm. And that makes it possible to specialize even further, because now someone with a specific condition living anywhere can consult someone who's an expert in that specific condition, regardless of geography. So you don't people who specialize, the practitioners who specialize are not limited to taking patients from a specific geography anymore. Now they can limit themselves to a even narrower specialization and take patients from everywhere. So I think that's a clear example of how technology can even further help the healthcare specializing. And the result is that it's better treatment for patients, because they get consultation with someone who understands their condition even better.
Absolutely. That's really exciting. The location being removed as a variable allows for more specialization on specific conditions and open doors for people to get better, more specialized treatment. That's really exciting to hear. As well, of course, people in certain countries where there's less access or it's more difficult to travel, things like a global pandemic,
Yeah.
allowing people to continue to get treatment.
Yeah, that's definitely the case as well. That in some places you don't really have proper access to healthcare. So I do think that technology can help in those places as well.
Exciting to hear. Well, let's start to talk about some of the technologies that are evolving now that are going to help continue to drive these trends forward and that have driven them to date. It sounds like AI is a key piece, AI technology of some of what's coming. Let's see, to start, you talk about transcripts, transcription, translation. Tell us more about what's evolving in this realm.
Yeah, AI is a very broad term, and people tend to think about when they hear about AI, they tend to think about an artificial brain that can work as an artificial doctor or something. That I don't think it's going to play out like that. So for me, it's more about taking a look at what already exists or what's coming in the next few years already, and then trying to plot a line from there. So if we look at what is close or already here, and we focus on the doctor consultation situation, it's definitely transcripts and translation. That's already here or just around the corner. A transcript is basically that you get a written, basically everything that's being said in a consultation is written down. So there's a text summary of the text transcript really of the consultation. And translation, that means that you will get basically live captions in the call, not only of what was actually said in the call, but also translated to a different language. So that if the doctor and the patient speaks different languages, the patient can explain themselves in their own language, and the doctor can see a translated version of that. This is technology that's already being demonstrated. We haven't seen it deployed in any telehealth services yet, but that's definitely coming. I think in the next 1 to 2 years, we will see that. It's going to be really good for the doctors to be able to let patients speak their own language and not having to always arrange an interpreter. There's a lot of pain involved in organizing interpreters. So definitely this is a development that's coming to telehealth really soon.
An exciting one. As someone with a sister who's deaf, who has to have a translator go with her in person to doctor's visits, this is something that will make it much easier for her to access great healthcare and understand what's happening in her appointments.
Yeah, I'm not convinced that sign language will be the first automated translated language, though. But it will probably come eventually.
Having the doctor's words translated into transcript that a deaf person can read.
Oh yeah,
and their ability to type back in.
Yeah,
that simply is enough. We could go on a tangent there of stories of her coming home from the doctor where we asked what happened, and she's like, I don't know. But anyway, I think it's exciting. Some of these trends seem like they will democratize, will open access to healthcare, which is incredible.
Definitely.
The next type of technology you talk about is NLP, natural language processing. What does that mean, and how might that one evolve? It seems like this builds on your last point.
Yeah, NLP is it's a technology that allows the computer to sort of understand natural language, and so the translation is a kind of a lightweight application of natural language processing in software. If we take it one step further, then something that I really believe will come in the next few years is automated creation of summaries. So a summary is basically whenever a doctor has a consultation with a patient, after the consultation, they have to write a summary of the consultation, a medical summary. It has different names in different places. In the US, it's commonly called a SOAP note. And this has to be recorded and entered into the health record system. That basically creates the audit trail for a patient. So it's a mandatory thing. They always have to do that. And they spend a lot of time of it. Almost half their time goes to writing summaries from medical consultations. And it's often work that they have to do in the evenings and like complete the SOAP notes from the day of consultations. So there's going to be a huge relief for practitioners if the computer can do this for them. And I'm convinced that the technology involved in natural language processing will allow this to happen in the next few years. Basically, the software will build a model based on what's being communicated in the consultation, and use that to fill in a template that's been created for various kinds of consultations. Store it in the health record system, and then not only do you save the time for the doctor to write the summaries, but also the summaries will be in a much better and more readable format. So it's easier next time the patient comes back, it's easier to read up on that patient than it was before. So multiple benefits here in application of one technology. How far out is this? I think maybe 2 to 4 years. There are already companies that are working on this. So this will definitely come, and it will also, if it's deployed in the right way, it also create a link between the telehealth consultation and the health record system, so you don't have to do any manual action to save the summary.
That's awesome. So back to the challenges we covered at first, an aging population and not as many hands. If we can make a doctor's time more efficient, they can, in theory, do more consultations and work with more patients. That sounds awesome. Let's talk about the third type of technology, driver assist. Not totally autonomous, but provides a lot of help to doctors.
Yeah, the term driver's assist comes from the automotive industry. When you buy a car nowadays, it's been talk about autonomous cars for many years, probably 10 to 15 years, and still they're not completely autonomous. But there's a lot of technologies that comes from that development of autonomous cars that has made its way into the normal cars that we drive ourselves. That's called driver's assist. Basically, my car will help me not straying across the line, keeping the lane. It will help me stop if there's something dangerous coming into the road, etc., etc. I believe we will see something similar in the healthcare industry. We will probably not see completely autonomous doctors like software acting as doctors for a very long time. But I do believe that once
Sorry, Svein.
once the natural language processing has come to a point where it's able to create a model of what's being said in the consultation, it can also look up in the model of medical knowledge, and basically come up with suggestions to the doctor during the consultation. What should you ask for in this particular situation? What examination should you do in this particular situation, for example? Very often, especially when it's about understanding a condition and making a diagnosis, the doctor can have multiple different potential diagnoses to make for a patient, and they need to they need to ask questions to differentiate between those. That we call differential diagnosis.
Okay.
And I believe that a computer can be a very good aid in that. The computer will be able to, better than the doctor, figure out what are the potential diagnoses for the set of symptoms that's being observed, and also come up with the differential. So yes, I definitely think that's going to be very useful, having help from the computer in the consultation. Doctors will be both more efficient and more accurate with that help. So I think doctors will want this. They don't want to make mistakes. They want to get...
Don't you think doctors who have been doing this a long time and tend to be a bit skeptical of technology, do you see them pushing back on this?
I think that once they see that it makes them more efficient, which they will see with the summaries, and they also see that this can make them detect things that they couldn't detect before, they will accept it. What I don't think they will accept is software purporting to be as good as doctors by itself. So I don't think that will happen in the time horizon, in the same time horizon. That will probably be 15 to 20 years out, I think. But this driver assist technologies, I think, will happen from 5 to 10 years from now.
So this driver assist technology will help during the consultation. How might that impact how patients choose a doctor and how insurance companies think about working with a doctor?
Yeah, good point. I think doctors will want to use driver assist because they will feel that it improves their accuracy. And insurance companies will definitely want to have doctors with improved accuracy. And patients will want to go to doctors with improved accuracy. So I think there's, in this case, once the technology reaches a certain point, everyone's going to want that technology to be deployed. And then, of course, it will, of course, be some doctors that start using it first, and then the rest follows. That's how it happens with any technology.
Let's go back to something you just said. Did you say that you foresee a world in which consultation is totally automated in 15 years? Is that what you said? What prediction do you have about a world in which we are not talking to a doctor?
Yeah, I mean, there's a line here, right? Like, if at some point the doctor is getting help from a computer, and like eventually probably the doctor will feel like they're just conveying what the computer tells them to do. When you arrive at that point, then maybe the doctor isn't needed anymore. But only in cases where it's about specific things, like making a specific diagnosis, for example. And more often than not, in consultations, there's a lot of other things at play as well. So I think we will have completely autonomous solutions, but I don't think they will replace the doctor as such.
Okay. Very interesting. So let's talk about the more immediate. How will healthcare look in the next 5 to 10 years? You threw out some timelines for some of the technology that you mentioned.
Yeah. Transcripts and translation next 1 to 2 years. Summaries. I think we will see. So the companies are already working on it. I think we will see deployments in a 2 to 3 year timescale. Like from 2 to 3 years, someone will start using this technology, and how fast it will go from there depends a lot on how good it is. It has to be. It has to be fairly accurate for this to succeed. When it comes to driver assist, 5 to 10 years. That's my guess. This is a
robot
little bit of,
robot doctors are 15, 30 years out.
yeah, I think so. Something like that.
All right. So let's start to talk about those challenges that we started with and how this type of technology can overcome them.
Yeah. The good part, I think, is kind of the obvious. Specialization and self-service option will improve customer friendliness. Like it will feel more tailored to your specific needs, and it can definitely reduce the manual work and the cost. And the same with natural language processing will definitely reduce manual work. It will also improve reliability because the summaries are better than they used to be, and actually also improve outcomes. And definitely that's the case with the driver assist. I think driver assist is a technology that will really improve outcomes with patients. Importantly, I think all of these technologies will help evening out the distribution of care. So make it less likely that you won't get the care you need if you live in a place that doesn't have the necessary resources, and also even out the access to care based on financial resources. So of course I'm an optimist, and I prefer to look primarily at the good sides and think that the development is mostly for the good, but we also have to think about the potential downsides. I think one potential downside that we should really be conscious about is that it might be that because of the high strain on healthcare, and because we are developing automated solutions, self-service solutions, for example, it could be that we get a development where access to real doctors becomes something that only a few people can afford, and everyone else have to only use automated solution. That, I think, is an very undesirable consequence of development. Yeah.
That time I did it on purpose.
Okay.
Yeah, that would be very disappointing.
So I do think that's a possible consequence, and we need to actually try to work against it. Yeah, I'm a fan of Western movies, so I had to put it into the good, the bad, and the ugly. And the ugly, a possible development is that some tech company or some tech companies monopolize the technologies that's necessary to automate and make it more expensive than significantly more expensive than not using these technologies. You could say that the similar is the case in the pharma industry already. Like some specific treatments are really expensive and monopolized. Yeah. That would be really bad if that happened. I don't think it will happen. Because if you look at the history of tech, it's more that technology is easy to. It's hard to make it, but once it's been made, it's easy to distribute and deploy widely, and it's more often than not also easy to copy. So usually there's a fierce competition between tech companies, and it tends to drive down price to everyone's benefit. It means that the value that the technology creates is usually distributed widely among the population, and I think this will be the case. but we have to watch out for this one.
That's an interesting point. And when we talk in a minute about who will be the most impactful actors as this technology evolves, I think that's one of the interesting trends for new players getting into building healthcare types of technology. But let's sum up. What's your view of how all of this will shape out? What's your prediction?
Yeah, I do think that in terms of overcoming the challenges in healthcare, I think the technology developments will mostly be positive, and we just have to watch out for the negative sides. I'd like to mention who I think will be the actors in this, because we have today a number of actors. I tend to think that the type of companies that are in this space today will also be the ones that will be prevalent in the future. I don't think we will get like a new type of company or anything like that.
Okay.
We do have traditional healthcare, hospitals, etc., and we have telehealth actors. I think these two will kind of merge or be blurred, at least. I don't see the traditional healthcare as something that will continue and not do any type of telehealth. They will gradually start doing telehealth. Telehealth companies will also start doing traditional healthcare in the sense that they can do physical consultations and examinations when that is necessary, or they have an agreement with someone. So I think they will both of these type of actors will continue to exist. There will be software companies that specialize in serving the traditional healthcare industry, medical record software, for example. And also today there is a specific kind of vertical of software that provide telehealth software for the traditional medical industry. I think those two categories will also become one. So
blended.
If you're a medical record company, you need to have telehealth software included in your package, and vice versa.
It seems
So
like
for
that's
them,
already happening. Certainly during the pandemic, you see players that help you find doctors like ZocDoc and others having telehealth added into their applications.
yeah,
You see more any sort of health technology platform adding in telehealth. Some of
yeah,
those were simply using Zoom, like technology that wasn't really made for this
yeah,
purpose.
yeah.
But it does seem like there's a lot more blending versus there being like specialized telehealth companies that are standalone.
Yeah, definitely. I think that the challenges that these two categories have currently, the medical record category have the challenge that they've been moving very slowly traditionally, so they need to up their game and move faster. The challenge for the communication category is mainly that the doctors want everything to be integrated into their medical record software, so they have to find a way somehow into being the most important tool for the doctors, and that could be either by collaborating with medical record or become medical records themselves. multiple ways there. And you mentioned ZocDoc, so that's another category. Booking sites, I think they have a really interesting position. They can evolve into also providing telehealth, and they will basically they will be funneling the patients into that system. So they have a good position to basically start working into the other categories as well.
Very interesting. Well, these were the key topics that we wanted to hit on today. Svein, in summary, is there anything else you wanted to share we didn't get to touch on?
I'm just really excited to see what the future brings in this space, and we at Daily are, of course, eager to create the functionality in daily to support this development.
Yeah.
So we will be part of it as well.
Absolutely. We are working with a lot of customers from mental health to all sorts of different, subcategories and creating really incredible technology. I think I'm most excited about the ways in which it will expand access to people for any and all reasons to give them access to better, more specialized care. Awesome. Well, thank you for walking us through this. I learned a lot going through this with you. And to anyone out there who may want to learn more about Daily or embedding live video, you can go to daily.co for more info. Look out for a blog post from Svein detailing some of these trends a little bit more as well.